Hi everybody, Ian Bremmer here, and updating you again on this extraordinary and explosive global crisis, coronavirus. We are seeing, perhaps most importantly from my perspective, the lack of international political response, the politicization increasingly of the crisis, leading to much less efficiency, much longer likely shutdowns as a consequence, and much more extensive economic impact as a consequence. We see that inside the United States. When you think about the fact that all of the governors and the mayors are doing different things, well, if you have shutdowns and your decisions on what is or is not an essential good is different from state to state, that makes it really hard to actually put together a supply chain for goods that are produced across those states. The implications are going to be larger. Also, you can shut down all of California, but if you don't have control over the state borders, and you don't, they're all Americans, they can move, then what happens when you try to get it restarted, but there are outbreaks in other states? It means that the likelihood of that restart is longer. Look, this is not a national crisis, it's a global crisis. It affects the entire world. We've not seen a crisis that has that level of extent in our lifetimes. The 2008 financial crisis was a piece of the global economy that certainly racked the global markets, but didn't have the same impact on every sector in the global economy. This is affecting the supply chain, and it's affecting global consumption. It's stopping people from traveling, it's stopping people from engaging in their livelihoods. If you want to respond to a global crisis, it's fairly obvious you need a global response. It's like if you're a human being and you have cancer and you go in and you see an ophthalmologist and he says, well, I know how I can fix your eyes. Well, that's great, but the cancer is still spreading. You've got to focus holistically. And what we don't have is a holistic response globally. And in fact, we have increasingly a lot of finger pointing between the United States and China. President Trump seeing that if we blame the Chinese for this, we can be on a war footing. We're fighting an invisible war against the Chinese virus. That's a good way to improve Trump's approval ratings. Frankly, being on a war footing domestically usually leads to an improvement in popularity. And we already see that happening, both in South Korea, where they've been pretty effective, but also in France and in Italy, where they're experiencing a real disaster economically, but the popularity of the governments has been going up because they respond to this patriotic, we're at war. Now, you can't win a war against terror, but you can win a war against coronavirus. You can defeat it. You can find a vaccine. You can ultimately get rid of it, even at vast personal cost. So that's clearly why Trump is doing it. But it needs to be a global war because it is a global pandemic, and there is not a global leader out there. We don't have global soldiers out there. There's no global arsenal to fight a global pandemic. As a consequence, the likelihood that this continues to spread gets higher. I think at the very least, this conversation about whether or not we want to extend the curve, which makes an awful lot of sense because you really do want to ensure that healthcare systems are not overwhelmed. You need time to build them up so that the number of people that are racing to see ICUs because they desperately need it, aren't turned away, and that would also lead to all other sorts of people that have critical care needs that also wouldn't get them. Those things are important, but if they're not globally connected, then the likelihood that you go from one country to another and then one successful, but cases pop up. We're now seeing that South Korea, Singapore, and Taiwan are seeing larger numbers of cases. Again, I have no doubt they will respond to them effectively, but these secondary outbreaks are coming in large part because the rest of the world isn't coordinated. As the weather gets warmer in our part of the world, New York, the Northern Hemisphere, in Sub-Saharan Africa and South America, it's much more likely that you're going to have new breakouts. Those breakouts will be larger if you don't have international coordination of standards. We are clearly a year minimum away from functional vaccines. We're much closer to that with the ability to, at scale, treat people that have coronavirus, but you're just talking about reducing some of the effects of coronavirus, not healing it. If we had something that responded well to flu, we'd be giving it to people with flu. We don't. And so the early stage, these medicines that are being talked about, including at the press briefing just in the last day by President Trump, we are going to see some success for people that are facing down the virus that have already gotten it, but that's very different from saying that this is somehow going to change, rebound the way that both human beings, society, as well as the economy are going to pick up. So, I mean, I do think that we're now looking like a shutdown in the United States, not just for a matter of weeks, but a matter of months. You're going to see that in Europe, and the potential of that hitting the Southern Hemisphere is growing. The human spirit is indomitable. The capacity to throw enormous amounts of science at this and get to a vaccine, I have no doubt we will eventually get one. But this is going to be a very trying time, and it's going to be made much more trying by the fact that the politics are so inefficient, are so misaligned. And I wish I could say it was just about the U.S. election. It's not. It's a global and much more structural issue. It's something we'll be talking about a lot more over the coming weeks and months. See you all real soon.